let's start there. I know you have said it's time to move forward. The family, though, feels like they are being threatened and they have been unfairly characterized publicly. They've even sent us list of messages through their attorney that show that they really feel they were not told to stay home. What do you say to that?
I think it's time to move forward. Our public health professionals and our nurses do this sort of communication every day, all day, with multiple types of communicable diseases. And I don't think it's good for our community to dwell on focusing on this family, what they understood, or the judgment that they had over the past few days. I think it's time to move forward and focus our resources on addressing the public health threat in our community. Focus our resources on protecting ourselves as individuals and respecting quarantine instructions and isolation instructions when they're given.
Is it possible that somebody gave you bad information, or there was some sort of lapse in communication that they did not actually get the message? Are you confident they got that message?
The information I have, I believe, is delivered with confidence. I understand that it's hard for me to get into a conversation of possibilities. I think that's an endless sort of spoke. I do think it's time to move forward. I do have confidence in our public health staff. The response has been incredible, and we're going to continue working with our public health partners at the state level and our regional partners and our local institutions and our healthcare providers to help take care of our community.
I'm going to move just a second.
Okay.
I don't like the way the flag's coming off the back of it. There we go.
Okay, so speaking regionally, are you talking with the mayor of St. Louis? You talking to St. Charles County? Tell me what's going on.
So I've spoken to the mayor of the city of St. Louis yesterday. I spoke to the leaders of St. Charles County, Jefferson County, and Franklin County, and we're all in communication. In addition, the Unified Health Command is communicating. That includes the public health directors of all of those jurisdictions.
What is the latest you can tell us? Do we have more cases?
No, all we know now is that we have one person under surveillance. We have one person that has tested positive, that we're also, the family members are under surveillance. We've had 15 individuals that have been under surveillance over the past month, and the others have been fine besides the two that we currently mentioned.
And you're talking about, you said you have one under surveillance. Are you talking about the Bayer patient?
There's one Bayer employee who is under surveillance and is being tested.
And are there others that are being?
There is one young woman that we know about, and then her family members will be under surveillance since they've been in close contact with her.
Okay.
And then there were several individuals throughout the community that had travel-related exposure and were quarantined at home for the appropriate length of time and then have been released.
Did they contact you all?
They contacted our health department through the public health line.
This is probably a question we should have been asking a long time, but just to be perfectly clear, we get some questions from people saying, what is presumptive positive? Can you put that in the most layman's terms?
Sure. So this is a new diagnosis, a new disease that we're learning how to deal with and learning about. But because it's a new disease, there is not an FDA-approved test for it. So we have tests that have been pushed out into the community because we need tests, but there's not a way to verify the results. So it's considered a presumptive positive until it's tested a second time at the CDC. So the sample is sent to the CDC for a second test.
Okay. What else do you want? What else do we expect you to hear later today? What else do you want people to know?
But the St. Louis County has an important footprint. We're coordinating very closely with the state health department. That our public health, the folks are following a plan. We have fully activated our emergency communications center. So we're in constant communication with leadership for emergency medical services, for public health response, and constant communication with our hospitals, monitoring what they're seeing and what they're hearing and what sort of symptoms are presenting. And this is what we do. We're watching what's happening on the East Coast and on the West Coast. We're learning from those responses, and we're making adjustments. But the role of the St. Louis County Public Health Department is to monitor what's happening regionally and around the world and around the country, to communicate what we're seeing and communicate advice and instructions to people in our community, and then to be prepared to respond. And we've already started doing that. We've increased our capacity on our phone lines. We're preparing to make a request from the state for additional protective equipment for our first responders and hospitals if they need it. We just want to have it close by just in case.
You
We
getting
want
what
to
you
stay
need?
ahead of this.
You're getting what you need from the state.
Yes. We have no reason to believe that they're not going to be able to provide us the equipment that we need, and we're in communication with them, and we're placing our orders.
What's the traffic on that phone line like?
So the emergency response and emergency communications, all of our orders from their reserves go through East-West Gateway. So we're currently collecting the needs from our regional jurisdictions, from our counties. We'll communicate that through East-West Gateway. We'll send our requests to the state, and the state will deliver those resources here locally. And then we'll be prepared to distribute them to people who need them.
That's good to know. I actually meant, what is the response from the public been like on the hotline?
Oh, so we do have a hotline for people to call, especially if they believe they have symptoms or they've been exposed. We like to refer people to our website, stlcorona.com, for questions, general questions about the coronavirus. But if you have a specific question about yourself or your exposure, then we would ask you to call our hotline, which is 314-615-2660.
And have a lot of people been calling it?
Yeah, we had over 300 calls yesterday. The vast majority of those were for general information. We would like to use that line for people who believe they've been exposed or need help with testing. We would like to refer general information questions to our webpage whenever possible.
Any idea how many people have actually been tested?
We've had, I believe we have 6 or 8 tests, but we could have more in our region that have been sent to the state.
And are we still awaiting those results, or will those all come back negative?
We may have 1 or 2 currently waiting with the state. The rest have come back negative, except for the one young woman that has been the subject of conversation this week.
I ask this knowing that there is a real responsibility not to alarm anyone unnecessarily, but what is your biggest concern? What is your biggest worry? Is it
Well, you know,
hospital capacity?
right, I think we have to be careful because we can see what's happened across the country, and we can see what's happening on the coast where this virus was first impacting the community. And we're learning from that, and we're preparing from that. We do have capacity in our hospitals. If this were to spread in the community as it has on the coast, then we would have to limit public gatherings like everyone else is doing, and wait for the virus to run its course and make sure the people that were really impacted and really sick from this got the hospital care that they needed. And we know that those folks that are most likely to be impacted are over 60 or people with chronic medical problems. So we're going to be ready to take care of whoever we need. We have the capacity in our hospitals, in our community, to take care of folks who get sick.
Like a lot of things that come to St. Louis after the coast, what are the professionals telling you, that we can kind of expect the same thing to eventually get to us, like the food
Well,
truck craze, or I mean,
we heard what the CDC has been saying. We heard what the Surgeon General has said, that we expect the outbreak to get worse before it gets better. I think that's probably true. We could see more of it in our community than we see now. It's hard to say where it stops or how much worse. It will be worse in some parts of the region, in some parts of the country than others. We believe that it came to St. Louis late, that when it came we were prepared. We were not surprised that it was coming. We've impacted a lot of controls. We were monitoring for it early. We had hotlines set up so when people came into town they knew to call, and they were given instructions and how to take care of themselves. And we're prepared to have the resources we need to take care of folks when we need to.
is that almost an advantage to some degree that we're not Seattle, I guess?
It's a definite advantage to not be surprised
Yeah.
that this virus was coming to town. And we believe that we have gotten in front of it, that our health department and our health partners are prepared.
So one parent said, let's see, that, okay, I guess her school have been having conference calls with the county about coronavirus. Anything you can tell us about that? I think this is like an element, maybe even private elementary school.
Right.
I don't know. Can you tell us what
I
they
know
do?
our health department has been in communication with schools and their school associations to help them make decisions and disseminate information. We leave closure of schools up to the individual school leadership At this point, we are not where the community is on the East Coast or the West Coast, and we have not made any sort of request to avoid public gatherings. We do think that folks who are older or otherwise at more risk of an infection from a coronavirus should consider whether or not they need to be in crowds. But there's nothing to indicate to this point that the coronavirus is available in our community to be contracted.
What else you want me to know? What do you want people to know?
Well, I think at this point we are well ahead of the coast and the rest of the world in preparation. We believe at this point the cases of coronavirus in our community are travel related, and we're prepared to try and get the word out to the community about hand washing, especially with soap and water, with hand sanitizer when that's not available. If you're sick, stay home. If you've been around someone who has traveled and has symptoms, then they should be considered to be positive until proven otherwise, until their quarantine is over. And you should also be quarantined or isolated yourself until we know the answer to those questions. And if we follow those guidelines in the community, I do think we can mitigate the spread. We can mitigate that in our community, and we can have a different experience than the rest of the world and the rest of the country. But I do agree with the Surgeon General that this could very well get worse before it gets better. But it doesn't mean we have to have the same experiences as the rest of the country. We need to work together. We need to be smart, and we need to think about how we're impacting our neighbors.
Okay, so that's kind of hard maybe for people to pin down. So you're saying, let's say if my spouse traveled for work, are you saying overseas or just any kind of
travel to an area of interest, and those area of interest are outlined on the CDC website. It includes Italy and China and Iran, and those list of countries, areas of concern change from time to time. But if you travel to an area of risk, and you come back to our community, then you should be isolated and go through a quarantine period. If you develop symptoms, then any close personal contacts, anyone that lives with you, should be quarantined as well.
Okay. Right now, though, that does not include a trip to Seattle, or does it?
That does not include a trip, but as you see, all major employers are limiting travel across the country at this point, and I think that sort of social isolation, so to speak, is a prudent step.
Are we to the point to where you would like to see the Battlehawks game? Is that a concern? Or the coming tournament to Scott Trade, are those concerns for you?
They're not a concern today, but we'll be watching that, and those recommendations might change. I think those decisions need to be made in coordination with our public health officials here in the county, with our public health officials in the state, and with the CDC. But at this point, with only travel-related diagnosis in our community, I think that we need to be wary of folks that are more at risk. And if we've been around folks that have symptoms, then those folks need to be quarantined. But otherwise, we need to go about our business.
Last question for me, and if there's anything else you have to say, I'm happy to hear it. Is the fact that this is happening in an election year making it harder for you to do your job?
Well, I think we have to be careful. Any major event in our region, whether it's this or anything else, has the ability to be politicized in an election year, and we see some of that all over the country. And I think we need to be careful. Everybody needs to work together to control the impact of this disease, COVID-19 virus, in our community, and we all need to work together, and this could be one issue that we set aside and we just work together to keep the community safe and try not to politicize it.
What would you have a message for anyone who is, for a lot of people it's easy to dump on a seemingly wealthy family from St. Louis County that maybe was reckless. Do you have any message to the rest of the community if they are in fact receiving threats?
I think it's time for some forgiveness. Perhaps the lapse in judgment has happened, but it's passed, and this family is acting in a way that's consistent with their instructions from the Public Health Department, and we need to move forward. It's all very frustrating. It's frustrating for everyone. I was certainly unhappy when I heard about it, but they're complying with our instructions, and we have the reassurances of folks in the community. There's a lot of activity on social media. There's people in the Ladue community. We've had no more reports. The Ladue Police Department is patrolling the area. We believe that their assertions to us are true, and we all need to move forward. It's a lesson for everyone that quarantines are important, that we take them seriously, and it's an important way to control the spread of this virus. And we see what's happening on the coast and the rest of the world, why quarantines are important.
anything the county maybe could have done better? Is it a lesson for the county too, perhaps?
Well, across the county and across the country, instructions from public health workers have generally been followed pretty closely. But we'll be looking at this particular incident. We'll go back and look at our communications, and we'll see if we're communicating in a way where it can't be misunderstood by everyone we communicate with.
Anything else you'd like to say, Dr. Page?
No, I think it's time to understand that we have coronavirus in our community, at this point isolated to a couple of individuals who acquired it in travel. But we need to watch our hand hygiene, our personal responsibility, all those things we do to protect ourselves, stay away from people who are sick, and if we're sick, stay home.
David? Anything?
I have just curious, just a quick question. Your perspective, not only from a doctor, but from the county executive. Do you think the media is handling this correctly? We're getting a lot of concern. We're getting a lot of blowback from people that there's too much information. NBC Nightly News dedicated 20 minutes last night from the beginning of the news, their world news. Every newscast locally has it. Are we doing a decent job? Is there something that you'd like the media?
Are we doing too much?
Are we doing too much?
No, I think this is something that needs to be covered because communication and public health strategies are such an important part of this. I think it needs to be covered in a responsible way. I think we need to talk about prevention and how to keep this from spreading in the community. We need to let people know what the guidelines are and help reinforce that message. But I think this is an important topic, and we see how it's affecting the rest of the country. We need to keep track of it.
Thanks for your time.
Yep.
Appreciate it.